Good morning. Good morning. How are you? I've missed you guys. Welcome to my channel. It's me, Dr. Ivie Apia. It's been a minute. I miss you guys. You know what? We're going to get into some serious topics today. And honestly, a lot of you guys liked last week's topic, so I'll do, more like that. Okay, let me just go ahead and drop the link for anyone already who wants to call in or comment. We're going to have some fun today. Okay, how have you been? Let me know. Today is Saturday. It's been a tough week. I've been busy working on my research, plus I have some new news. Finally, one of my projects was actually accepted to a very prestigious journal that I've actually respected for years. So I'm so happy, I'm so glad, and I can't wait for you guys to actually see it in print. But yeah, we're gonna have some fun today. And for those of you who are new, welcome to my channel. My name is Dr. Ivie Apia. Most of you guys know my background already, but I'm in internal medicine, so I see patients who are adults. And then also I'm a nephrologist, so I went on to do further training in kidney disease. So, some of you guys may actually, have questions. So, this is supposed to be a support system for all of you guys, okay? So I'm gonna let you guys kind of trickle in already. So good morning, Queen C. Yes, good morning to you. She says, good morning, Dr. EVA, smiling faces, and everyone in the chat. Love it. Thank you so much for being here. Okay, let me just do a quick sound check. Okay, very good. And visual check. I just want to make sure we stay on point. Okay, very good. Yes, perfect. The other thing is I wanted to mention, we are looking at potentially different times. I know Saturdays can be hit or miss for some of you, so just let me know what time works best for you. And potential topic ideas. There's a lot of options here. And some of you who are interested in medicine also want to see more cases and more data and more research. So you guys are in for a treat. But really the point of this channel is to, I say this every week, uplift and, really educate and try and demystify some of the pitfalls that can take place in the healthcare system. People are definitely well-intentioned, but, this healthcare deal is supposed to really enhance our lives and make it easier rather than just kind of being, a victim to it, or this is happening to me, if you know what I mean. We just need to, sometimes just refresh our attitudes about certain topics related to healthcare. And part of that is just understanding your own worth and your own value. There's a lot we can do with this channel. Like, for example, you guys, if you guys have followed this channel, we have talked about everything under the sun. Whether or not to mask, that was early on in the pandemic. I was recommending we wear masks before the CDC was recommending we wear masks. And that was during the time that there was some concern about not having enough protective equipment for, healthcare providers. I was still recommending that we wear them. That was early on. And then the second thing is, some of you guys are really interested in careers in healthcare, not just, becoming physicians, but also, nurse practitioners, nurses, and other allied health professions. I am your girl for that. So just continue to, keep up with the channel. We're going to be doing some medical mysteries, and I definitely want your opinion and your input, especially for those who have healthcare experience. And by the way, a lot of you guys who actually follow this channel are physicians yourselves, and or are in the healthcare field as well. So definitely chime in. I want your participation. Now, one of the highest rated episodes that we've done was about, you know, how do I say this? Basically, concerns for couples, things that couples should talk about. And part of our discussions have been about reproductive health issues. And in fact, that's actually my area of interest, is women's reproductive kidney health. So that's actually what my research that's coming out in American Journal of Kidney Diseases. So I can't wait for you guys to see the conclusions of that. But yeah, I mean, having these hard conversations, we've done it all, guys. And a lot of variety of topics, because you guys are so diverse, have a lot of interest, and I definitely want to keep up and serve, the best content. So as you're coming in and as you're strolling in, absolutely like this video, hit the thumbs up, because that tells YouTube that, this content is being enjoyed. So hit the thumbs up, subscribe if you haven't already, and you're in for an amazing treat. Just sometimes, we're going to have those hard conversations and just have fun with it, okay? Because we're all figuring this out together. So all things health and wellness, definitely subscribe if you're interested in those topics, and then hit the thumbs up, because we're growing this platform. Okay, so let's just dive right into it. Okay, today we're really going to be talking about how to make the best healthcare decisions, especially in, a modern society in 2021 with the pandemic still hitting. How do you actually make a decision? So what really inspired this topic is just, it kind of came to me in the last couple of days. Sometimes we do go to the doctor and there's a recommendation, hey, I would like you to start taking this medication. Or, for some of you who are concerned about the vaccine, should I be taking it? Should I not? When should I take it? What should I be looking out for? We are honestly faced with these decisions all the time. Okay, and so, yeah, Queena C says, I'm a healthcare worker. Exactly. So thank you again for joining. We have some amazing people who follow this channel, like amazing, dynamic men and women, sophisticated people who are trying to just elevate themselves, and we're all in alignment. So this is our growing platform. But like I said, all of us are honestly faced with decisions all the time in our personal lives, in our family, at work, and healthcare is absolutely no different. But sometimes I just wonder, okay, but how do people actually come to the conclusions that they do, or maybe change their mind? So I just wanted to give you guys kind of a step-by-step approach for how I make my own medical decisions, and a framework that you can use as well, okay? Because life can get complicated, but if you go back to some of the basics, it's easy, guys. Okay, I'm gonna break it all down. So, let's see. Sharon Swain, good morning. Thank you for joining this live. We're gonna have some fun today. Okay, so let me just share my screen with you. The entire screen or just the window? Okay, this one. So how to make the best healthcare decisions. We're gonna have some fun, okay? By the way, if you haven't already, follow me on Instagram. I'm on Instagram, I'm on Twitter, but I'm most active on Instagram. So we get, some snippets also on Instagram. So definitely follow me if you're not already, all right? And that's my Twitter and Instagram handle right here, at Dr. Ivie OA. Okay. So, okay, so this is actually a very important slide. I just want to spend the next like 15 to 20 minutes. We'll keep this simple and relatively short. What? So the first question is, what are your personal health care goals, and how do you define your own life? And from there, we'll come out with an algorithm. So it's easier to make decisions if we know, where our values lie and what's actually important to us. What are your priorities? And actually, I'll tell you, when I'm seeing my own patients, particularly for the first visit and the first few visits, I actually want to get to know you, how you think, what's important to you, what are your values, because all of this is related to your healthcare delivery, right? I can make a recommendation, but if you disagree or have concerns implementing that, then it's not going to work. I'll give an example in a little bit, but this is something that's really important to me because you're more than just a disease, like a body of diseases that I have to push pills and push pamphlets on you. That's not my style. That's not my approach. And I think in modern medicine, we're becoming increasingly aware of, incorporating the whole person and their values. And that's for sure true in nephrology or kidney disease care. But coming back to you and anyone here who's watching, we need to know, how do you define health? In the past, we've talked about health being, more than just the absence of disease. Just because you're skinny doesn't mean you're healthy. Number one, right? Or just because someone's, has that, beautiful body does not mean that they're in shape or that they're really, okay. It doesn't mean that. So we have to sometimes change our perspectives. We talked about 2 weeks ago, Simone Biles. Literally an Olympic gold medalist is having health issues, mental health issues that she's overcoming and was, generous enough to share that with us in the public. So that's extremely important. We have to define what is health in your own life. What does it mean to be healthy? And so one of the questions I ask you is, if you're my patient, is what are your personal health goals? What do you actually want to accomplish? It's important. Every time I move, you guys know this if you follow the channel. Every time I move, I have to have, generally a new physician. If I'm moving far away, either a new physician, new hairstylist, new nail stylist, gas station, grocery store, all that stuff, right? Same thing in healthcare. Like if you're having a new healthcare provider or adding somebody on, this is important. And I want to encourage you to have that conversation with your provider. And I want to have that conversation with you and all of my patients. What are your personal health goals? And usually what I hear is something relating to weight and feeling, just having, a better weight. Obesity is becoming increasingly popular, unfortunately, in the United States. And there's some health implications on that, but we all have, something we're working on. For others, I've seen discussions about reproductive health, like, hey, I want to, be pregnant in the next 2 to 3 years. How do I maximize my healthcare to be able to do that? I will help you through that. I hope what I'm saying makes sense. Now, for some people, it can be as simple as being as healthy and strong as possible. For other people, and as a provider, I absolutely want to be able to manage the medical issues that are going on if they are there. For example, diabetics, heart disease, hypertension. Of course, those are the big ones, especially for my adults. But in general, I want to encourage you guys to, review this topic periodically, especially with new team providers. So if you're moving, if you add someone onto your team. And another way to answer this question is, how do you respond when your doctor or healthcare provider asks you, what brings you in today? What do you guys think? That is a very good, I think, a good introductory, statement question. What brings you in today? That means you have usually an objective. There's a reason you made this appointment. There's a reason you want to see a doctor. And for sometimes it's just a wellness visit, but sometimes it's a little more complicated. Okay, so what are your personal health care goals? Define it for yourself. And remember, this may actually go back to something else we've talked about, defining, having your own spiritual practice so that you can gain clarity as to what's important to you versus not. It's not just, oh, I just want to be skinny. But, there are some things that are probably in your heart that you really, do want to address and want support. So let me give you a couple of examples, as a provider, and for, many of you who are also in healthcare, you may come across different people at different stages of their lives. And of course, their priorities are gonna, be different. So when I'm talking to the 19-year-old male or female who's healthy, I may have a different approach or perspective, right? That person, that 19-year-old, just wants to live life and have fun, most likely, oftentimes, right? And actually, I do too. I'm not 19. But oh my gosh, you know what? Sometimes I feel 19, but anyway, they may not have anything to say about, okay, what are my healthcare goals? But for the next three case scenarios, for example, the 32-year-old woman with lupus, one thing that comes up to me is how good is your lupus controlled? Because, for certain diseases, there are flare-ups. There are good days and there are bad days. And lupus is absolutely one of them. There are a lot of celebrities who've come out and talked about their experience. But lupus is a big one. And one thing that as a kidney doctor I'm concerned about is, reproductive health issues. If someone is interested in having a family, how do we support that woman through this? And sometimes lupus can actually, cause issues in other parts of the body. For those of you guys who are not familiar, lupus is an autoimmune condition that can affect different parts of the body. And, sometimes it can affect the skin, it can affect the heart and the kidneys, amongst other, of course, the joints, right? So basically the immune system gets revved up and attacks the body in specific patterns in this lupus condition. And it's actually kind of common, relatively common, in African Americans, or people of African descent, I should say, Hispanic or Latino backgrounds or communities. This is very common. Really, anyone could get it, but those major groups in particular. So that's something I may want to know. So it's not just what the patient says, but it's also trying to help guide answers to questions that were not even asked. Okay, so the next case scenario is the 50-year-old man with diabetes, who may also have chronic kidney disease. Of course, diabetes, it's the leading cause of chronic kidney disease. And depending on the flavor, if you have type 1, which takes place early on, versus type 2, usually later on in life, there are some things we need to work on. So you are more than just your collection of diseases. However, I have to make sure that these things are under control. The last example is this 82-year-old woman with hypertension who's becoming increasingly forgetful. Sometimes I may be in the office and a patient will come with family and support system saying, hey, I have some concerns. So having a good support system is important. So is that increasing forgetfulness? Perhaps just lack of sleep? Or is it a little bit more nuanced, like an early dementia, earlier signs of dementia, okay? So what I'm saying is that at different stages in your life, with different conditions, your priorities may change, right? The 19-year-old just, wants to maybe get a physical so he or she can, be on the basketball team in college. The 32-year-old woman with lupus may be concerned about pregnancy planning. The 50-year-old man with diabetes and chronic kidney disease just wants to stave off, decline of the kidney disease to requiring dialysis. So how do I support that? The 82-year-old woman who's being brought in by family may have concerns about safety. If the patient is becoming increasingly forgetful, maybe we can't leave grandma or grandpa at home alone as much anymore. Okay, so there are different things. I may not be so strict with blood pressure control in that age group, knowing that, grandma or grandpa may not have, 50 years of life left. I hope what I'm saying is making sense. There are different priorities, and you know what's going on in your own life. So feel free just to feel empowered just to really share what's on your mind, okay? I'm just giving it to you from my perspective, or as a provider perspective, like behind the scenes, like what are some of the things that I may be thinking. But for you, okay, questions to consider. What are the risks and benefits of the proposal? So your physician or your provider may say, hey, I want you to start a new medication. Like, how do you respond? How do you even wrap your mind around a proposal from your doctor, right? Or, they're telling you, get this third vaccine or, booster vaccine. How do you make these decisions? So these are some questions that I thought helped us to organize our thoughts so that we can make our best decisions for ourselves. Okay. So first of all, question to consider, what are the risks and benefits of a proposal? I'll just say, for the sake of example, I'll just use like a blood pressure medication, right? So if your doctor says, hey, take this medication, okay, you have rights to, ask questions and just clarify a few things, right? So of course, most physicians are certainly well-intentioned, they're doing it from their own perspective, with their medical training and scientific, research. But, you also have rights. I have rights, heck, So the question I would ask is, what are the risks and benefits of what's being considered? So what are the risks of taking this medication? So another way to say that is, what are the potential side effects? Sometimes there are immediate side effects, and then there are cumulative side effects to consider. So that's number one. And then what are the benefits? If I take this blood pressure pill, the blood pressure will, hopefully come down. And what does that mean for me? What that means is that you likely are decreasing your risk of heart disease, heart attack, and stroke, which is, like you guys know, the number one cause of death in this country, okay? Then the next question I would ask is, what are the risks and benefits over time? So this is an important one, and this is a nuanced one. Okay, so I want to just really want you guys to get this. Risks and benefits are not just at one point in time. Sometimes they are cumulative. And this goes back to what I had just mentioned earlier. I may approach a 25-year-old with high blood pressure differently, new onset high blood pressure, differently than this has happened, a 97 or 98-year-old. By the way, I have quite a few patients. I've seen quite a few patients in that age group over, my medical career. It happens. People are living longer. They're doing great. And by the way, I asked them what their secret is, and people just say just managing their stress, honestly. But again, my approach may be different. I may not be so hard pressed to lower that blood pressure if you're literally 100 years old. And of course, every time, every person is, different. But lowering the blood pressure in a 25-year-old will be Very important, so that they don't have a whole lifetime of high blood pressure, which could affect the heart and affect the kidneys and affect other parts of their body that would limit their mortality, right? Or limit, their lifespan, versus a 100-year-old who now for the first time has high blood pressure. I'm going to say, wow, tell me, what was your secret? What were you eating? What were you doing? I mean, tell me, right? So this is very different. And sometimes, these medications, they have benefits over time. And so we need to see, where are you in your life? Not just age, but where are you in your life to warrant something new? Okay, next thing that sometimes people forget: what happens if nothing changes? So if my doctor says, take this blood pressure medication, what happens? What are the risks and benefits of doing nothing, of the status quo? Right? There are risks and benefits of starting something, and also risks and benefits of not starting something. Sometimes we forget that staying the same and doing nothing is also a choice and also has consequences. Okay, so that's an important point. This is certainly relevant when we talk about, whether or not to mask, right? Whether or not to take a vaccine, for example. I was just counseling my patients and say, hey, this is the data that we have when it comes to the COVID vaccine. In fact, we've talked about this on the channel already. The Q&A session from just a few months ago about the vaccine and all of that. What happens if I don't take the vaccine? Okay, well, there are things to consider. Risk of potentially getting COVID and potential complications of COVID. Okay, what are the risks of the vaccine, which are legitimate? Anything you put into your body, is important and valuable. And so those things also need to be studied, right? And that's why there have been so many trials and studies and safety protocols in place, even out of what they call an abundance of caution. So we need to ask ourselves, what happens if you do nothing? And then finally, I would say, what are the necessary costs and effort for the proposal? Classic example. Ooh, you guys are saying stuff in the chat. Classic example is weight loss. I think everyone, generally agrees that it's healthier to not be obese, right? This is a universal, essentially near fact. Okay, that it's better, lower BMIs, healthy range BMIs, are better for your heart and body in general, right? But if I'm telling you lose weight or encouraging weight loss, there's a cost and there's an effort. There's your time, maybe a gym membership, and is it even worth it? Or maybe now is not the right time if you have a 2-month-old baby. Maybe in 6 months to a year, we can talk about more sustained efforts for weight loss. So again, it just kind of depends. This is how I break things down, literally for myself, for my own healthcare issues, and also things I consider for my patients, right? So I just wanted to at least, point some of those things out, okay? And let me just see what you guys are saying in the chat, okay? And we'll be wrapping up actually just in a couple of minutes, excuse me. So Queen of C. Oh, you say, I haven't been feeling good lately. Oh, I'm sorry to hear that. That's what I say. Oh, what's going on? I want to know more. Feel free just to, comment in the chat, or, we can talk offline too. But there's a lot going on. This pandemic, there's just so much going on. Everyone's under an extreme amount of stress. And, sometimes I really do have to go back to the basics. I treat myself like, I would a child. making sure that I'm well fed, sleep well, hydrated. Literally, last year in 2020, I started exercising again. After I haven't done that in years, I had to do it literally for mental clarity, like for my mental health. It wasn't like it's fun. Oh, like I love to jog. I'm like this. That's not me at all. That's not actually me. I'm the girl who doesn't even like to sweat in the past. But once I get used to something, it kind of grows on me. So I feel you. I'm right there with you. Sometimes we're just off, and then if you have a touch of sickness, that just throws everything off. But sometimes when something just feels off, the word healthcare sometimes is used as malaise, just feeling unwell. I just go back to the basics, slow down with what I'm doing, get some sleep, and go back to the basics. I hope that makes sense. Just diet, exercise if appropriate, and getting a lot of sleep. And then calling my girlfriends, my good friends. They always support me. Yeah, I'm sorry to hear that, Sharon Swain. I agree. Praying for you too. AP Leo Queen, hi. Good afternoon. Thanks for joining us today. She's AP Leo Queen says, hello, Dr. Ivie, in the chat. Thank you so much. Black Diamond. I actually love this name. Black Diamond. Good morning, Queen Dr. Ivie. Thank you. You always make me feel so good. I appreciate that. Am I a queen or a princess still? in my mind, I'm a 19-year-old. Actually 21. I always say I'm forever 21, but thank you, Black Diamond. Okay. Yes, Queen says hello to Leo Queen. Perfect. So, okay, so Sharon shares with us, I started taking blood pressure medicine around the age of 28. Okay. See, that's the thing. At least some people see this as a negative, but for me, it's like, look, at least it was identified. It was caught early. And that there were possibilities for intervention, that you have a medication that's available that works. For example, I can't give, person A the same medication for person B, even if they have the same health issue. Do you have underlying liver disease, kidney disease? I can't just do a one size fits all. So I'm glad that you actually got supported through this and got help. So, thank you for sharing that. It's important. Just, see the doctor and get it treated. Absolutely. Okay. Oh, okay. You just took your second vaccine. Okay. You just took your second vaccine this morning. Congratulations. Good for you. That's actually really big. Okay. So again, for any of you who want to call in, please do so. I'm going to just finish up with my PowerPoint and then, get your last round of comments and questions, okay? Okay, so let me add this back. Okay, so this is a real world example. Okay, so this is actually a graph. It's a visual abstract from actually one of my favorite publications, JASN, the journal associated with the American Society of Nephrology. This is our premier group for kidney disease, right? So I got this straight from CJASN. And basically, this is talking about the effects of a newer class of medications, canagliflozin, on renal and cardiovascular care. So basically, this is a study where they looked at diabetic patients, 10,000 diabetic patients, and broke them in half. So half of them got this new medication called canagliflozin, and the other half got placebo. okay? And you can see on the graph, the x-axis is years, and then the y-axis is something called eGFR. Basically it tells you how good is the kidney at working. So the higher the number, the better the function. And normal is basically like 70 to 100, basically, okay? And for those who have kidney disease, sometimes they can drop less than 60, and patients who have a low eGFR, they can have an eGFR of less than 10, okay? So basically, this was a revolutionary set of medications. These are Sglt2 inhibitors, for those of you who are interested or are physicians or in healthcare. These were novel meaning like new and innovative medications for essentially diabetics, but they may have other uses, right? So we wanted to see how effective is this medication on diabetics? And what they found was that initially, those with the new medication actually had a drop in their renal function early on, right? But over time, over a number of years, they actually did better. They had better preserved kidney function. So that just tells you that, you know, risks and benefits are not just at one point in time, but it's cumulative over time. And so I thought the study did a great job of demonstrating that. So the blue is actually the canagliflozin group, or this new medication. The orange is the placebo. And they had 3 different groups depending on the amount of protein in the urine. So normal protein, I'll focus on this particular section, which are those who have some increased protein in the urine, and that suggests some kidney disease. But again, early on, it looks like in the first less than a year, there was an initial drop in kidney it appears in the kidney number. But over time, in the long run, those who had the new medication actually had a better GFR. So sometimes you have to, you know, lose a little, but in the long term, you gain a lot. So that's why it's important to do studies, and that's why it's important to do studies over time and interpret data carefully, right? And the same is, you know, essentially true for those who have severe proteinuria. I hope that makes sense. I hope what I'm saying makes sense. It's kind of complicated, but that's honestly one of the benefits. Sorry, I forgot to expand this, but that's really one of the benefits of joining this channel, is that we actually get into the nitty-gritty, because you guys are so smart and curious, and I can't just give you, you know, basic generalization. No, you guys don't accept that, and I don't want to, you know, give you that. So, you know, in the kidney world, this was a very revolutionary study, and there are other kind of cousins of this medication, canagliflozin. So it's really important for diabetics, you know, especially those who are at risk of kidney disease. Hey, there's this new medication. So if I'm in the office and I'm recommending this medication, which I have, I have to share this with you. I want to be able to share this information with you and say, hey, here's some anticipatory guidance. In the beginning, the numbers are going to look bad, and it may seem like, oh my God, this medication is just terrible. But in the long run, after years of follow-up, it looks like we were able to save, you know, and preserve the kidney over time, versus those who would not take those medications, right? So the conclusion is that here at the bottom is that that the effects on the kidney are greatest amongst those who have severe albuminuria, or protein in the urine, okay? And that it was preserved even amongst those with just moderate albuminuria. Just fascinating, you guys. That's another benefit of you guys just being on this channel. We're going to go into the science. We just don't talk generally. We're going to go into the actual science and share with you, literally, this is revolutionary stuff in our field. And many of you, maybe some of you guys are even on this medication for all I know. Even though it's relatively new, this is amazing revolutionary data, okay? But we're gonna get into the nitty-gritties and get into the science, especially for some of you guys who are actually interested in medicine, okay? So I'm just going to just end with this slide and then see what you guys have to say. So the last thing I want to say is this. Here are the key tenets. What I want to leave you with is make sure that you as an individual define your own health priorities and value them, respect them, and then refresh periodically. Okay? For some people, they want to live as long as possible no matter what. Okay, got it. I can help you with that. For some people, they're just more focused on comfort. And you know what? In fact, there's a physician even here on the chat who's I know is watching. And she actually is a geriatrician, and she deals with end-of-life care. And actually, for anyone who's elder, especially end-of-life, these are things that will be relevant, especially down the road. Here's another time that it's relevant. For example, are those whether or not to start dialysis. For some people, they say, "Look, my kidney has failed. I want basically another." Functioning kidney, so they may seek transplant. In the meantime, let's do dialysis. For others, they say, oh no, that's not something I envision, going to a dialysis unit 3 to 4 times a week. No, I'd rather just not do that, and I would rather just live on the kidney that I have, and if that kills me, so be it. These are things that, sometimes it's hard to talk about. For many of you who've had maybe sicker parents or family members who've been sick, you have to go back to the basics and say, what are my priorities at this point? And of course, they can change as we age or as new issues come up. For other people, it's cost. I know for myself, I always like to prescribe medications that are on the $4 list. If they're equivalent, there's an expensive one and a cheaper one, I just go with the cheaper one for ease of my patient. So again, you have to define your own priorities, value them, respect them, you are worth it, and then refresh them periodically. The second tenet I just want to share with you guys is you have a right to change your mind at any point. That speaks for itself. Thirdly, communicate your experiences with your healthcare team. And finally, avoid starting or stopping medications without discussion with your healthcare team, because there are some things that they have in mind that they're may be aware of that you may not be aware of, and vice versa. Some people just stop medications because hey, it's just upsetting my stomach, I can't do it. But meanwhile, if something happens 3 months down the line and I'm under the assumption that you're still taking those medications, I'm making a false assumption. I don't assume. I always like to refresh, and just say, hey, is this still the case? Are you still taking these medications? So again, if we go back to this previous slide, if this person had stopped taking a medication 6 months in, hey, you wouldn't have necessarily gotten the benefits, right? Compared to 2 years or 6 years, potentially. So of course you have a right to change your mind, but all I'm saying is just communicate those things with your healthcare provider or your healthcare team. So that's really it. I'm just gonna close and see what you guys have to say. Again, feel free just to call in or comment in the chat, okay? But I hope this is helpful, that there's a methodical way to make decisions for yourself, for your family. And these are the kind of rubrics that I'm using. Remember, there's risks and benefits to doing something and to not doing something, okay? And it has to be in alignment with your values. You can make decisions based upon your values. And we have to respect that, right? Okay, so I'll close up with what you guys have to say. And again, last call for any comments or if you want to call into the chat. Okay, last call. So let's see what you guys are saying. Queen of C says, no, I'm feeling good. That's what I say to my doctor when I go for this. I understand. Okay, good. Good. I'm glad to hear that. AP Leo Queen is just greeting people. Thank you so much. Black Diamond says, what happens to a person with diabetes, high pressure if that person gets vaccinated? High pressure if that person gets vaccinated. Okay, good question. And that goes back to, the issue of who should really get vaccinated. So the vaccine is really meant to provide protection and build your immune system. Basically, the vaccine just stimulates your immune system so that the necessary cells are primed and stronger. So when your body encounters the actual virus in the environment, your body has gone through this lesson before with the vaccine. So the goal is to create a stronger immune response. But that's a very good question. Who should be vaccinated and who should not be? There is some concern about, hey, what do we do for immunocompromised patients? Those are people who are particularly at increased risk for getting the virus, unfortunately. So those were people who were initially targeted, right? You guys may have recalled with the initial rollout of the vaccine, the healthcare workers were being prioritized, as well as the elderly, as well as, those with medical conditions, and diabetes is certainly one of them. So it really would act the same in diabetics versus not. The question is, really who should be vaccinated. Now, there's another issue amongst those who are truly immunocompromised. Classic examples, HIV. Sometimes we have concerns about our dialysis patients, transplant patients who are literally taking medications to suppress their immune system. So that's an very excellent question. Okay, Queen of C, should I add you into the chat? Okay, are you ready? I can add you onto the chat, okay? Oh, okay, Okay, looks like we lost you. That's no problem. It's a complicated question, but yeah, very good question, Black Diamond. It stimulates the immune system. And, the question is, what is the benefit? Is to reduce your risk of potentially getting the virus and also the duration that your body is ill from if you do get the virus itself. But of course, this does not replace hand washing and wearing masks. Absolutely. And just trying to minimize unnecessary exposure. Okay, I'm gonna add Queen of C to the chat. Let's see.
Good morning. Hi, how are you?
Hi, how are you? Good afternoon.
Good afternoon to you. I need to ask you a couple of questions about getting the vaccine. Like I said, I just took the second dose this morning from CBS.
Yeah.
So, what my question is, like I hear a lot of people say, like take a lot of vitamins such as vitamin C, which I have been for a couple of years now. Elderberry, vitamin D, zinc, and some others. So is that effective?
Oh, I'm sorry. It's a little bit hard to hear you. Did you mention vitamin C?
Yeah, and some more. Can you hear me?
Yeah, it's a little bit muffled, but I think I get the gist of your question. That's a good question. What do you do once you've gotten the vaccine, right? Okay, so immediately after getting the vaccine, this is just my recommendation, okay, is honestly, I took some pain medication. I took some pain medication. I was having I think it was on this side. I had some arm pain a little bit. So I just took like a little bit of Tylenol, and then I just went about my life pretty much the same. I mean, I have the same exposure, so I just still wore masks and still was doing hand hygienes, but I took the vaccine
Mhm.
end of last year, and then the second dose the beginning of this year. So I just basically stayed the same. I wasn't, because I'm still high risk, because I'm always around people who,
Right.
who are ill.
Yeah.
But otherwise, sometimes, people felt a little more comfortable to, live in the same house and not necessarily wear masks if everyone in the home is vaccinated and, being careful. So some people, did that. And then, of course, some people felt comfortable traveling, especially at the end of, like, more so the beginning of this year. So it's just kind of about your comfort level. But that's a very good question about the vitamins. I actually don't know the data about vitamin C and the vaccine or anything. I'm not aware of that. I'm not aware of that. I honestly feel like, vitamin C is fine overall to take. Definitely don't get to toxic levels. Just a normal multivitamin generally is good.
Okay.
Now, there was another question about vitamin D. I'm happy to review that maybe next week as well, because vitamin D is helpful with like calcium and bone health. And there's some concern that, hey, is there increased risk of getting COVID if you're vitamin D deficient? But no, I'm not aware of the specifics with that data and how that relates to the vaccine. But I'm happy to look more into that and review with that, next week. Yeah.
Okay.
But I didn't do anything differently.
Okay. So a lot of people, like coworkers, were saying when they had first got it, they was like, "Be sure to take some Advil or Tylenol before." But
Right.
I do a lot of reading. I had heard that not to take it before, like you can take it afterwards, like if you have like pain or whatever.
Yeah, I think it's just personal preference.
Right.
I thought it was fine. I would be fine if people took it beforehand.
Okay.
I honestly, I did not. I
I
actually,
didn't either.
yeah, because
Mhm.
you're in healthcare. Do you give shots too, or?
No, no,
Yeah.
just I work in a assisted living facility.
Oh, okay, got you. So yeah, I wasn't really that worried, but I think the next day, like later on, 10, 12 hours later, and then the next day, I did feel it.
Right.
I felt it, and I had
Okay.
no issue. Mm-mm.
So did you have issues with the first shot or the second one? Because with the first one, only issue I had was uh sore arm and redness. That was it.
Oh, okay. I'm trying to remember. I think it was the first one. I think it was the first one, and then the second one there wasn't. Yeah, there was no issue. Yeah.
Okay, okay, okay. So that's what I was wondering because you hear a lot of people say. Like I
Yeah.
tell people, body is different. Some people don't have anything with the first or the second, no kind of,
Right.
side effects from it. So,
Yeah, exactly. And, I know there's a lot of controversy about the vaccine. I didn't want to go into a lot of details about
right,
that, but
right,
basically, again, it goes back to your own personal decisions. But, I think, the government, everyone, the FDA, everyone's just having, you know, they're just being very careful. And
right,
so,
right.
you know how it goes, like with research and studies and stuff like that. They're just being
Hmm.
really careful. So, so far, still with the data that we have, effects from the vaccine are still relatively rare.
Right.
Um, and the COVID is not rare.
Mm-mm.
So we just have to keep that in mind. But, for every person, it's their own personal decision. Period.
Exactly.
You know?
Exactly. Because I was like, I'm not taking that. They ain't did enough research for me. And then I had talked to an ex coworker a few weeks ago, and I had been praying and asking God to show me something. So I talked to her, and she said that her and her husband both had got the Delta variant, and I was like, oh God.
Yeah, we are.
And
Oh my gosh.
I was like, she's better now. That's been like 3 weeks ago. She's doing her and her husband are both doing better. So
Okay.
so
Thank you.
I felt like that was confirmation. I was like, she was like praying with me. It was like, Miss, she was like, Queena, please, baby, I'm begging and
Mhm,
pleading,
mhm,
begging you,
mhm.
please go take that vaccine, please.
Yeah, it's hard. I mean, I'm just hearing so many just terrible stories of, people
Yeah.
dying, and it was really hard because I'm in, the Northeast. I'm in New Jersey at least
Okay.
now, and a year ago, I was like so just devastated,
Yeah.
all just death, death, death in
Uh-huh.
the city. And so my personality is just like, hey, let's just get the information out there and then people can make their own choices.
Hmm.
My concern was not that people aren't standing up for themselves. My concern was, hey, Black people in particular
Right.
getting disproportionately killed by this thing. One.
Exactly.
And
Hmm.
right. And then two, my
Hmm.
concern is that there was so much misinformation. If you're going to
Yeah.
make a decision, that's fine, but do it based on facts, on science. And I just hated
Right.
that things were becoming more politicized. Like, I didn't know masks and science could be a political issue. I
Mhm.
mean, 100%. Well, I knew it could be, but I didn't know to this extent.
Right, right.
Right?
Exactly. Yeah. Yeah. When
You know what I mean?
C-19 came in town, I tell you, we had lost a whole lot of our residents. Oh my God.
All right.
A
Well,
lot, a
wait a
lot.
minute. You residents died in your hospital?
Yes.
Oh gosh.
At least 9 or 10.
Okay.
Hmm.
When you say residents, do you mean, are you talking like healthcare,
Mm.
like
Yes,
residency, like
the
physicians, like?
people. No, the people that stays at the assisted living.
Okay, okay, yeah, the residents in your facility. Okay,
Hmm. Hmm.
yeah, and rest in peace.
Yes,
Rest
yes.
in peace. But we got to keep going and have joy in our hearts and our lives. But I'm not gonna like ignore the obvious either. You know what I mean?
Yes, ma'am.
Yeah.
No, yes, ma'am. Well, thank you for taking my call. I just wanted to know,
Yeah,
get your perspective on everything.
I appreciate it. Yeah, for me, I took it. I took it, and I'm glad I did. Yeah.
Thank you.
Thank
And
you,
enjoy the
Queen.
rest of your I said Sunday. Oh, Saturday. Enjoy the rest of your Saturday.
I
Thank you so
appreciate
much.
it. You too.
All right. Bye-bye.
Hi, dear. She is awesome. Thank you so much for calling in and sharing your perspective. Like, we have just amazing people on this platform, okay? I'm just going to, wrap it up by finishing what you guys are saying. So Sharon Swain says, Doctor, it is controlled because I take my medication. There you go. There you go. And good for you for like checking. Here's my other thing. Can I just go on a small little tangent? I've seen that more people are getting more and more involved into herbs and supplements and all this stuff. All I can say is just like, write it down. Just know what you're actually taking, the actual ingredients of it, and then can you just let your doctor know or your nurse know that you're taking it and put it on the medication list. Why? Because, I think that I do believe that truly at the end of the day, Mother Earth has everything that we really need. I heard someone say that online and I'm like, yeah, but I mean, we do get medications from plants and herbs and stuff like that, in our natural environment. We're literally harvesting what's in our environment from plants and just all this exotic you know things that we have on our planet, so that needs to be valued and respected. However, at the same time, some things are not really well studied and well regulated. They may have one intention and then have a completely different side effect. That's true for anything we take in. So all I can say is, if you're going to take some herbs and supplements to lower your blood pressure or control your sugar, just make sure that those things are actually working. And so therefore still, come and see your doctor. They shouldn't be a replacement. They should be supplementary or complementary. You know what I mean? And if that's your value set, you prefer more natural and natural things, I respect that. I will work with that. But come and see me. I want to know. I want to know what those things are really doing, right? Let me just finish up. Oh my gosh, hi, thank you so much. Ibdashid says, hey, Dr. Ivie, thank you so much for joining us this afternoon. Black Diamond, you are the, I love Black Diamond. You are the sister queen. I did it with a little, little added, I can just add a little bit. Okay. Thank you so much. Always, always. Oh my gosh. Let's be friends. You're incredible. Okay, Sglt2 Medical. Thanks for explaining and going into detail. It's my pleasure. Okay. Shout out to Sglt2 Medical. If any of you are interested in healthcare, I highly recommend that you look at Sglt2 Medical's channel. This is an amazing organization that's based out of Chicago that encourages people to get into health career and healthcare fields. They have an extensive portfolio on their website and on their YouTube of people from various backgrounds sharing their experience of how they got into medicine, their story, and what life is like as, a provider. And many of them are like all sorts of providers, physicians from all different specialties, and people from other specialties like pharmacy and all these allied health professionals. So it's an amazing organization. I've worked with them in the past, and the physician that runs this group is incredible. So shout out to them. Thank you so much, Sglt2 Medical, for supporting us. So again, young people especially, if you're interested in healthcare or medicine or anything like that, please let me know. I will personally help you. And then certainly I can connect you with Sglt2 Medical. Okay. So a couple more things. So let's see. AP Leo Queen says, after 2 years, I finally went to the doctor recently to get a CBC done. Good. With my results, confirmed some of the changes I made for my health benefits. Okay, very good. For those of you who are not familiar, CBC is a blood panel, comprehensive blood I don't even know what's CBC, the end of C. You see, you use these terms so commonly and then I forget. But basically it tells you, what is your white count, your hemoglobin or basically red blood cell count, your platelets. So it tells us a lot of information. For those of you who are anemic, we would find that out in the CBC. Anemic meaning low red blood cells. Extremely important. Sglt2 Medical says the conversation about priorities and goals is huge. Right, thank you so much. And it goes back to knowing ourselves, and I'm constantly doing that on literally, at this point, like a weekly basis. Black Diamond says high blood pressure, right, extremely important. AP Leo Queen, do you have some recommendations, on something natural to help stop smoking? Good question. I don't. I have medications, but not something natural. Some people do quit cold turkey. It's hard. But habit stacking is one way. So instead of using, smoking, on a daily basis, replace that with some other activity. Some people chew gum, like the nicotine-based gums, but natural, I don't. Let me know if you find out some, more information about that. That's a very good question. Yeah, please stop smoking. For anyone who is smoking, I'm not saying that anyone on this channel is, but if you know someone who is, please stop smoking. Cancer kills. Next, Black Diamond. I am a diabetic on insulin and taking blood pressure medicine. Okay. Hey, at least you know what it is and you're taking the necessary steps. Thank you so much for sharing that, Black Diamond. Okay, just a few more comments. Sharon Swain says, I have both doses and I take black seed oil, and other vitamins too to keep up my immune system. Good for you. Okay, very good for you. Yeah, I'm in favor of multivitamins. For my young ladies, remember folic acid is important, especially if you're considering pregnancy. It helps reduce risk of neural tube defects. And remember, look at the back of the bottle for the number of vitamins you're supposed to take. So just because they're, just be careful. Sometimes to get the regular dose, you actually need 2 pills, not just one, or 2 gummies, not just one. That messed me up in the past, okay? So next, AP Leo Queen says, after taking shots, I usually massage it consistently with relaxed oils. Good for you, plus good for your mental health and clarity. I love that. What oils do you use? Can we talk? Like, can you message me? I wanna know what oils you use. I'm seeing more of like my patients or people on this platform talk about like essential oils. For those of you guys who know the star Real Housewives of Potomac star Monique Samuels, I know she has an essential oils line. So I do follow her, and she's always talking about these oils and how to use them for healthcare benefits. I'm just curious, what is your experience with that? Okay. The reasons I haven't had the shots is because of what Bill Gates and his deceased father said. I won't expound. Okay. I am not sure what they said. I'm going to look that up. Queen C says, you're welcome. Thank you, darling. Yes, my doctor knows all the OTCs I take. See, this woman is incredible. Okay, OTC means over the counter. Rude. I guess that means I should go soon. Sorry. We're closing up. It's a live show. That's what Wendy Williams always says. It's a live show, guys. Okay. Queen C, thank you. Thank you. Zara, I agree. I'm natural health consultant, and that's quality control. I would love to know more about what you do, because like I said, I'm becoming more aware of these natural herbs and supplements, and people are always asking about them. But I didn't study that in med school. That's not my specialty, but I'm becoming more and more familiar with some of them. Some of them I'm aware because they actually caused problems that we presume they've caused problems that I'm now dealing with. But for some people, they swear by it. So I would love to, can you subscribe, and please follow this channel, because I want to know more about what you do. And maybe you can help answer some questions too, okay? That's really important. Okay, so, and that's true, quality control is important. Yes. Sharon Swain says her oils are amazing, perfect. Oh, she is right. Okay, so see, thank you. This is the point. This is community. So Zara, our resident natural health consultant expert, is making some recommendations or giving some information. We're not giving advice on this channel. We are giving information, and then you can make your best, decision. But something that she is saying is lobelia essence helps to stop smoking. Okay, I will look that up. I'm not familiar with it. I have some other ideas in terms of formal or traditional medications that will help. So thank you for sharing your knowledge. I appreciate that. How can I contact you? Okay, perfect way to end. You can contact me on Instagram. You can contact me on Twitter. My handle is at Dr. Ivie OA. I'll put it in the chat too. If you want, you can also leave a comment in the actual YouTube comment section. So yeah, you can get a hold of me any of those ways, and then I'll respond back. In fact, I've actually had a few sessions with people. I've had a few sessions, not just like healthcare, but also like how to get into med school or med school interviews and things like that. So yeah, please definitely, just send me a direct message or DM on Instagram, and we can connect further. No problem. Yay. And then subscribe to this channel. And if you guys haven't already, on your way out, hit the like button, subscribe to this channel because you are in for a treat. Absolutely. This is just, free, easy breezy health information on a Saturday. I just want to be accessible for you guys, okay? And let's see, I used a lot of lavender oils, but haven't dived into the whole essential oils dynasty like Monique. Okay, yeah, I'm new to all of this too. I actually just recently got a diffuser and got some essential oils. So, yeah, so far it's just for like my room rather than like, formal health benefits. So, absolutely, everything we talk about is private and confidential. Absolutely. Yeah, absolutely. So thanks for clarifying that. Okay, guys, it's been a pleasure. Thank you so much for, supporting this channel. On your way out, absolutely like this video, subscribe if you haven't already, and tune in next week. We're going to get into some more medical mysteries. Absolutely. And I want your thoughts. I want your thoughts and I want your perspectives, okay? So come with your thinking caps on, come with any questions that you may have. And if you have your own medical mystery, heck, message me. Absolutely message me so I can do some preliminary research, and then we'll do some other medical cases as well. But like I said, everything we talk about is confidential, period. Or unless you want to share something on the platform, feel free to do so. That's completely fine. But I respect all of you guys, and thank you so much for watching. We will catch you next week, okay? Thank you. Bye.